Okay, so this is the second and last part of this healthcare policy lecture. And so I just want to note one of the many different policy issues that occur in this area. And this is a trade-off. This is a balancing that's attempted by policymakers between cost and quality. So I had alluded to before about the nature of costs and how they keep escalating from year to year. And so historically, we've been trying to contain costs. This was one of the major impetuses for putting together and putting into place or implementing the Affordable Care Act was that it was getting out of hand in terms of how much we're spending on healthcare in the U.S. But of course, in addressing the cost, we want to make sure that we're offering the same quality in terms of the care that people are receiving. And so it's a balancing between the two. We want to be able to maintain costs as a governmental matter or a policy matter. We want to be able to contain or mitigate some of the costs and yet still maintain the same level of quality that we offer. And so this is just one of the many issues, as I was noting before. But first, just a point about costs. So much of the costs, right, not a majority of costs, but much of the costs will come from the government themselves. And so I'm showing here enrollment and spending on public health insurance, right? So we have Medicare and Medicaid. These numbers are a little bit outdated. They're from 2010, but I mean, they serve the purpose here. Just to note that it's expensive, right? It's expensive in the way of providing health insurance coverage to the U.S. population, public coverage. You can see the enrollment numbers, right? 50, 60 plus million people enrolled in Medicare and Medicaid respectively. And then CHIP is relatively small, less than 10 million people enrolled in this supplemental program for kids. And then look at how much we're spending. We're spending close to $1 trillion. We're slowly approaching $1 trillion in the way of public or government health insurance spending. And so, again, the point is about the magnitude of the spending that we undertake for health insurance in this country. Now, another way to think about it, right, is how these costs or healthcare spending have increased across time. And there are two different columns here, two different sets of figures. Total spending, right, indicated here, and then per capita spending or spending per person. And however you cut it, this is adjusted for inflation, right? So without inflation, if we were just looking at nominal numbers, I mean, these numbers would be even more staggering. But even adjusting for inflation, look at the degree of increase that we see in terms of total health expenditures in parentheses. These are the percent increases every 5 years, close to 50% increase in spending, adjusting for inflation, 30%, 30%, 20 to 30%. So one may think, well, isn't it just a function of an increasing population? We keep spending more because our population is increasing. Well, even if we're considering the population increase, right? So if we look at per capita increase, how much do we spend per person? Still, the numbers are still substantially high here. And so we're looking at there are upwards of 30% spending, or spending increases, 20% spending increases. So the point is, across time, the spending keeps increasing. Another measure, percent of GDP, or percent of the total economy that goes towards healthcare spending. In 1950, only about 4% of all spending in the U.S. economy was devoted to healthcare or health expenditures, but you can see how this keeps escalating as well. 1/6 of our economy back in 2010, at the time of the Affordable Care Act, implementation was spent on healthcare, and then by next year, we're probably around 19% right now. And then by next year, we're going to reach 1/5 of our entire economy is going to go towards healthcare spending. Another indicator of the out-of-control costs, right? We're looking across different countries. Well, how much does the U.S. spend relative to other rich countries, other comparable countries? And so we say, well, how about as a percent of our total economy or total spending or a percent of GDP? You can see this is from 2007. So from 2007, you can see that the U.S. spends 1/6 or spent 1/6 of the total economy went towards healthcare spending. No one is even close. The next country is France, coming in at 11%. If we're assessing per capita spending, again, this is 2007. The U.S. was spending over $7,000 per person on health expenditures. The next closest country was Norway. They weren't even at $5,000. And then we want to assess in this last column so to what degree is the spending done by the government? Well, this isn't just government spending. It's mostly private entities, right? In the U.S., you can see that the percent public in the way of health expenditures is only about 45%. Less than half of all spending is done by the government in terms of healthcare spending. And compared to some of these other countries, Norway, 84%, Japan, 81%, the UK, over 81%. So you can't blame that on the government, right? This is mostly private entities spending more and more on health expenditures. So it begs the question of, well, what is exactly going on here? Why do we spend so much in the US? Well, there's a number of different factors. There are demographic factors, certainly in the way of the aging of the population. Our population, the proportion of the population that's 65 and older keeps increasing, right? And that's the baby boom generation reaching 65 in 2011. So that generation is a huge generation. It was characterized by a large, much greater rates of fertility during the baby boom generation. Those born between 1946 and 1964. So we have an aging population. We have lots of litigation going on. So more and more lawsuits against pharmaceutical companies, right, and their practices, their maybe not so best practices. The health insurance companies, lots of different lawsuits, even conducted by the government. We have to pay salaries, so doctors, nurses, health professionals. So those salaries keep escalating. We need to be able to afford those expenses. And then some of it is just waste, just flat out waste. So I note here in the way of administrative expenses. So you want, ideally, you want your administrative expenses to be as little or as minimal as possible, so it's not considered waste. But the US relative to Canada, you can see what the expenses are as a percent of total healthcare spending, 31% in the US versus 15% in Canada. And then, of course, we have technology. Our technology is getting better, so we have to pay for that technology. So there are a lot of things that are going into these escalating costs and why we spend so much in the US here relative to other countries. And so the other part of this scale is, of course, in terms of quality. Well, you would think with how much we spend in the US across time and across different countries should yield some better indicators of the quality of the care that we're providing. So in terms of access, you would think that all that we spend, are we doing better in terms of access? Well, certainly the uninsurance rates are going down, right? We've seen some improvement in the way of the uninsurance rates, but 13.4%, if we're looking cross-nationally, most countries, most rich countries, have 100% insurance rates, right? 100, at worst, 99% insurance rates, so still we're lagging behind. So another measure of access. So in terms of wait times for elective surgeries, right? Elective surgeries, so not those that are emergency room based. We're a little bit better. I note here we're a little bit better than UK, but about the same as France and Germany. Another way in which we assess the quality of care being provided is just in the way of public health. And the two primary measures of public health that we often use is in terms of infant mortality and life expectancy. First, in terms of life expectancy, US, compared to other rich countries, one of the lowest, or not really, well, nowadays it's below average. It's not quite at the bottom of, in terms of the rich countries, but you can see I've provided here some of the numbers in terms of life expectancy. Life expectancy in the US, 81, most people can expect to live to age 81, versus some other rich countries, Canada, UK, France, Germany, they're all upwards of 83. And then, of course, infant mortality, these are the deaths per thousand live births. US, much higher, right? Significantly higher if you're evaluating statistically, 6.1 versus much lower rates. France and Germany, 3.5 or 3.6. So this is the issue, and I would be very wealthy if I could design the solutions for some of these issues that we have, but just one of the many issues that we have in this area of healthcare policy. So that concludes this lecture. Next week we'll take up the issue of international poverty, and of course we're reading the first three chapters of the Sachs book. All right, so we'll stop there.